Hello, today we will be talking of another parasympathetic ganglion, that is Pterygopalatine Ganglion. So it is the another parasympathetic ganglia apart from ciliary ganglia and the otic ganglia that we have talked in our previous lectures. So Pterygopalatine Ganglion is the largest of all the ganglias that we have talked of. This ganglia is also called as Palatine ganglia, ganglia of hay fever, and Meckel's ganglia. So these are the three other names of your Pterygopalatine ganglia, that is sphenopalatine, hay fever, and Meckel's ganglia. So as I have said, it is the largest ganglia among all the other three that we have talked of. So this is your Pterygopalatine. Now talking of the connections, topographically it is connected to what, and functionally this ganglia is connected to what. So topographically this ganglia is connected to the maxillary nerve. So maxillary nerve, as we know, it is the second branch of your fifth nerve, that is trigeminal nerve. So the connection, or it is connected topographically to the maxillary nerve, but the functionally fibers of facial nerves are carried through this ganglia. So functionally it is connected to your facial nerve, and topographically it is connected to the maxillary nerve. If we talk of location, so it is lying in the fossa, which is called Pterygopalatine fossa. Right. Now talking of the roots of this ganglia, so it has got three roots as the other two parasympathetic ganglia, that is parasympathetic root, sympathetic root, and the sensory root. So we'll be talking of these three roots one by one. So first of all, parasympathetic root. So the fibers of parasympathetic root arises from the two nuclei, that is lacrimatory nucleus and your superior salivatory nucleus, which is located in the pons region. It is originating from these two nuclei. Now the fibers will descend down from the part of facial nerve, that is nervus intermedius. So through this nerve it will come down, and then at the ganglia, which is the bent of facial nerve called geniculate ganglia, it will pass through it. Later on it will enter into the another branch of your facial nerve, that is greater petrosal nerve. This greater petrosal nerve later on, after connection with the deep petrosal nerve, forms nerve to pterygoid canal. So the fibers are coming from two nuclei, one is lacrimatory nucleus and superior salivatory nucleus. It will travel through the nervus intermedius, which is a branch of facial nerve, passing through the ganglia, that is geniculate ganglia. Then it enters the first branch, that is your greater petrosal nerve. Later on into the nerve to pterygoid canal. Then finally this fibers are going to reach the ganglia, that is your Pterygopalatine ganglia, and it will relay in this ganglia. After relaying, the fiber will go into one of the root of your maxillary nerve, through which it will enter into the lacrimal gland. Right. So through the maxillary nerve, then entering the zygomatico nerve, then zygomatico-temporal nerve, then via lacrimal nerve it will supply the secretomotor fibers to the lacrimal gland. Apart from that, the fibers are also going to supply the secretomotor fibers to the orbit, that is the orbitalis nerve, through the nasal cavity to the nasal nerve, through the palatine, that is palatine nerves, to the hard palate and the soft palate, and through your pharyngeal branches to the pharyngeal cavity. So they are going to supply the secretomotor fibers to lacrimal gland, nose, eyes, your palate and your pharynx. So these are your secretomotor fibers or the parasympathetic fibers of the pterygopalatine. So the fibers which are before your relaying is called preganglionic fibers, and the fibers which are after the relay is called postganglionic fibers. So the relay is occurring in this pterygopalatine ganglia. Alright. Now we will be talking of sympathetic roots. So for the sympathetic root, the fiber is originating from your lateral horn of spinal segment T1. They will ascend up, reaching into your superior cervical ganglia where the relay is occurring. The postganglionic fibers are originating from the superior cervical ganglia. It runs along the plexus, which is around your internal carotid artery. Now then the fibers are entering through your deep petrosal nerve. On the way to ganglia, the greater petrosal nerve joins with the deep petrosal nerve, forming the nerve that is nerve to pterygoid canal, which passes through the ganglia without relaying, because relay has already occurred in the superior cervical ganglia. So the fibers are entering through the pterygopalatine ganglia without interruption, supplying the blood vessels of the nose, nasopharynx and the palate. So they are going to supply the vasomotor supply to these areas. So this is the sympathetic root. Lastly, we will be talking of sensory, and the sensory is the fibers are carried by your maxillary nerve, and without relaying these fibers will pass. So there will be no relay in this ganglia for the sensory as well. So that's all for pterygopalatine ganglia. Hope this is helpful for you. Thank you so much.